Today, we are going to go over the color Doppler on your ultrasound machine. Although it is one of the most used modes of ultrasound, it is frequently not fully understood by the clinician using it. We will be showing you this modality on two machines. First, the Mindray M-5, which is a fully functional laptop-like machine, and secondly, on a newer Philips Lumify linear array scanner, which represents the newer generation of super compact point-of-care ultrasound machines. I picked these two machines as they represent both ends of the size spectrum and also because I own them. It is important to know what information the color Doppler is telling you. You must use the correct parameters so that 1, it operates and produces data, and 2, so the data is useful to you. As clinicians, we often make important treatment decisions based on what the color Doppler is telling us, so it's important to ensure that this data is accurate and that we understand what it means. Our patients rely on us. As with any scan, first we will optimize the image using depth, focal zone, gain and time gain compensation, and dynamic range. Let's take a look at the radial artery and optimize the scan now. We're going to give the probe a second to settle down. And now we're going to go ahead and hit the color button. Now, when we hit the color button, an ROI or region of interest box comes up. Now, let's make the ROI an appropriate size for the radial artery. We're going to do that by hitting the set button on M5. Now, all ultrasound machines have these functions. It's just a matter of finding them. So on M5, let's hit set. Now, when we do this, a small square appears in each of the 4 corners. We're going to now adjust this size using the trackball. We're going to go ahead and trackball left and right, which is going to adjust our x-axis we're with. We are going to then trackball up and down, and that is going to adjust our vertical axis or our y-axis. Once we get to a good size for the radial artery, we're going to go ahead and hit set to confirm our choices. Once we hit set, we notice that we have the dashed line region of interest box again. We're going to go ahead and drag this up to the area where the radial artery will most likely be encountered, which will be up in the near field or the Fresnel field. Now, we can also hit the control knob to the right of the trackball. Inside there's a button. When we hit this button, the ROI becomes white. We can go ahead and adjust the rotational knob clockwise, and that will move the steer angle to 12. If we hit it again, minus 12. And if we hit it again, back to 0. I'm going to go ahead and hit the button in the middle and return us back to the dotted line ROI. That steer angle will help us if we are not absolutely parallel to the object that we're scanning the fluid in. We're going to use that mainly in plane. Right now, we're going to be showing you out of plane techniques with the color Doppler. Now, what we're going to do is we're going to go ahead and scan. Now, before we scan the radial artery, I want you to look at 2 other important features. What we're going to do is we're going to look on the bottom right-hand side of our screen, and we see the invert. We're going to make sure that invert is off. Second, we're going to take a look at the scale. And that scale is that colorful little line to the left-hand side of the screen that says 5.7 centimeters per second and minus 5.7 centimeters per second. This is our scale, which is referred to as the Nyquist limit. Now, 5.7 is perfect for the radial artery. We're going to take a look at it in a second. We're going to go ahead and get the radial artery in view. And we notice that we get a mixed bag. We get some red, we get some blues, and some yellows. That's because out of plane, as we are right now, to the radial artery, we are perpendicular to the flow. So the flow of blood is not going towards or away from the probe. What I want you to do now is we're going to tilt the probe so the lens is looking down the hand. As we do that, we'll notice that the flow becomes blue. Now, what we're going to do is we're going to go ahead and tilt the probe so the lens is looking up towards my heart. When we do that, we notice that we get mostly red reflections. This is because of the pneumatic BART, blue away and red towards. It's how the color flow is coded on the ultrasound machine. Now, give the probe a second to always settle down when we first get the data, and make slow movements. Altogether, that is BART in a nutshell. We are going to take a close look now at the color scale. First on the M5. Right now we have it set for a radial artery at 5.7 centimeters squared on the Nyquist limit. When we scan our radial artery, the color scale works fine. Now, let's see what happens when we increase the scale. Sometimes in my department, a machine will get marked out of service for biomed to fix because the clinician noted that the color Doppler did not work, only to find out that the scale was set too high for what was being viewed to work properly. Now, let's put the color scale back to 5.7 centimeters a second and scan our carotid. Remember to first optimize the scan using depth, focal zone, gain, and time gain compensation, then dynamic range. Then we're going to hit color and adjust the ROI box and its position. I'm going to go ahead and point the probe with the lens facing caudad. So right now the color should read red for blue away, red towards. The blood is coming towards the probe. You'll notice that we get red, yellow, and blue. This is a phenomenon, again, known as aliasing. So what we're going to do now is we're going to adjust the Nyquist limit higher so the aliasing goes away. Let's get a good picture of that carotid. And right there around 30.1 centimeters per second, we get good color differentiation. So let's go ahead and point it up, cephalad towards my head. And then again, we get blue away. Now, we're going to increase the Nyquist limit until we get good differentiation every time we use color. In order to judge this, we have to have the probe pointing either cephalad or caudad. We also want to give the probe a second to settle down each time we do a scan using color. The Philips Lumify is more of a POCUS type machine, having only presets instead of full control over settings such as the Nyquist limit when using color, gain, in particular there's no TGC, and dynamic range. To change color scale, you need to change the exam type and flow. There is either fast or slow flow on certain settings. Let's take a look at each one of them. If you know a better way to change Lumify settings, please add it in the messages below. I'm always hoping for an upgrade to make Lumify fully customizable with gain, color scale, and I would love TGC and dynamic range so it could be utilized more in the classroom. So when we take a look at Lumify here, we're going to go to our first setting, which is going to be vascular. So let's select vascular and select scan. Now, when we do that, we're going to be confronted with our imaging screen. We're going to go ahead and change our depth. I'm going to just make that down to 2 for our radial artery. And then we're going to go ahead and hit our color flow option for vascular. Now, I'm going to go ahead and hit slow flow. Let's try slow first. And when I do that, I'm confronted by the region of interest box. Now, let's make this picture full screen by hitting the little arrows at the bottom right-hand side. And we'll notice the ROI has a dot in the bottom center. Now, what I can do is I can grab that dot and I can change the steer angle. I'm going to just keep it that way. I can also move the ROI within the scanning box. And I can also use hand gestures to change the X and Y axis. Now it does have limits, but it's pretty good. So let's go ahead and go up and down with our fingers. That'll change our Y axis. And now we're going to go wider and narrower to change our x-axis. Now we're going to do the radial artery, so it's going to be pretty small. So we're going to basically limit this thing out as small as it'll go. Let's go ahead and drag the ROI up to the near field or the Fresnel field. We're going to put it in the center of the screen. We're going to go ahead and gel up. And let's take a look at our radial artery. Again, we're using the slow feature on the vascular preset. So here's our radial artery, and I'm facing towards my body, and there's my red towards, a little bit of aliasing. Our scale is 9 and -9. Now I'm going to go ahead and face down towards my hand as it turns blue. And that's pretty nice color. Let's go ahead and get out of this, and let's see what happens when we hit fast. So we're on slow flow. Let's turn that off. Let's hit color flow and change it to fast. Now our scale is set at 28 centimeters per second and negative 28 centimeters per second for Nyquist limit. Let's take a look now. I'm going to go ahead and tilt towards my body. It's a little blunted, but I can still see it. Now I'm going to go ahead and change the pitch or the tilt down the hand. You'll see there's almost no aliasing. And I've got a very dark blue going away. So our BART, blue away, red towards, is a little bit blunted with a Nyquist limit so high as minus 28 and 28 centimeters per second. Let's try another preset. We're going to go ahead and hit our little arrows. We're going to go ahead and end the exam. We'll hit yes. Let's go to superficial and scan. Let's hit color flow again. Now we're going to have to optimize this setting. So we're going to change our depth to 2 centimeters. We're going to move our ROI. We're going to hand gesture, make it smaller, and drag it up to the near field or the Fresnel field. We're going to go ahead and take a look, and our scale is set at 5 and -5, similar to what we had it on the Mindray M-5. We're going to go ahead and find our artery. And when we're perpendicular, you'll notice we have some aliasing, some blue and some red. We're going to point towards our head. And there's our red color for red towards. Now let's go down the hand with the lens facing my hand. And we'll notice we get blue away. Let's see what happens when we go to fast. And on superficial here, which is our setting, current setting, I believe, we only have the slow setting. So let's go ahead and end the exam. Let's go to on lung. There will be no color setting. That has special lung parameters set for it. Let's go to MSK. And when we hit MSK and then scan, hit color flow, we have fast and slow. Fast, our Nyquist is going to be set at 7. Slow, our Nyquist is going to be set at 4. Let's just see how that affects. Again, we're going to want to optimize again. Let's change our depth down to 2. Optimize our region of interest box. Here I'm pointing towards my body, and I get quite a bit of aliasing. Now away from my body, I get mostly blue, but you'll see because of our lower Nyquist limit, we do have some aliasing. In this setting, we only have the slow option. Let's end the exam. And that was MSK. And let's go to soft tissue, hit scan, and on soft tissue, we only have slow flow again. And let's just see what that's set up to. Let's change that down to 2. And slow is going to give us a Nyquist limit of -4 again. So those are the presets on the Philips Linear Array Lumify probe. Let's wrap up how to use the color Doppler in your ultrasound machine. First, optimize the scan using a depth of 1 centimeter deeper than the region of interest. Adjust the focal zone if you have one, the gain, and the time gain compensation for maximum contrast. For me, this is typically contrasting with the hyperechoic needle. We're then going to move the DR dynamic range for best smoothness when scanning static anatomy and contrast of structures when scanning moving objects such as the heart. Hit the color button and adjust the ROI size and position. Then adjust the Nyquist scale for best separation of the blue away and red towards color. Last, ensure that BART is working out and that the invert is not turned on.